Last year, state and USAID spent more than $52 million on global health efforts in Liberia, Sierra Leone, and Guinea combined. But I know in my constituency, they ask, where did all that money go? It has become apparent that these countries did not have the healthcare infrastructure in place to handle or contain the Ebola disease, and as we have seen, it can spread to Europe and North America. And with the communist dictatorship in Cuba sending hundreds of forced labor healthcare workers to Ebola-impacted countries, we've got to ensure here in the United States that we are taking every possible precaution. It is appalling that the Obama administration officials are praising the Castro communist dictators for forcing these workers, forcing them to go to Ebola-impacted countries in Africa. These healthcare officials do not have a choice. Their families face retaliation on the island if they don't go. They are forced to go as part of a coordinated PR campaign orchestrated by the regime for its own political agenda. And it's disgusting and shameful that, that we should be congratulating Cuba for forcing people to go to these countries, and ask the regime what happens to those workers if they're found to be impacted with Ebola. They're not allowed to go back to Cuba. Here are some facts about Cuba and its healthcare apparatus. In the 1980s, that same Cuban regime, the same people, sent HIV-positive patients to concentration camps. The regime has taken out life insurance policies on behalf of its workers, but instead of naming the families as beneficiaries, any insurance dollars right now go to the regime. The regime is not exporting its workers for free. It receives approximately $8 billion per year that it uses to oppress the Cuban people. Cuban healthcare workers receive less than 25% of the money from donors that's supposed to pay for their salary. The rest is confiscated by the regime.